Hot flashes are a common symptom for menopause experienced by 75% of menopausal women and can be described as a sudden feeling of warmth or heat in the body. Hot flashes may occur on their own but are often accompanied by night sweats or excessive sweating during the day. Hot flashes and sweats can also be accompanied by feelings of nausea, dizziness, or a general feeling of being unwell. In this video, we are going to discuss hot flashes signs, remedies, and treatments. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash the like button and subscribe to never miss out on any of our videos. Hot flashes are caused by a decreased production of the hormone estrogen and occur naturally as women approach menopause. While they are natural, they can also be treated with natural hot flash remedies. While some companies sell herbs for hot flashes or vasomotor symptoms are the most commonly reported symptom of perimenopause. A hot flash typically happens rapidly and lasts from 1 to 10 minutes. Women can experience hot flashes a few times a week, or even 10 times a day. A hot flash is a sudden warm feeling over your face, neck, and chest that may cause you to sweat and your face to turn red. Hot flashes combined with sweats that happen while sleeping are often called night sweats or hot flushes. Hot flashes and night sweats are common in patients receiving cancer treatment. Some people continue to have hot flashes and night sweats after cancer treatment. There are a few kinds of medicines that can help ease hot flashes and night sweats, but they also may cause side effects or have certain risks. Hormone therapy works well to reduce symptoms, but women need to use caution with HT. Men can use estrogen or progesterone to treat their symptoms after treatment for prostate cancer. In the past, physicians prescribed hormone therapy to improve overall health and prevent cardiac disease, as well as for symptoms of menopause. Combined estrogen/progesterone therapy, but not estrogen alone, increases the risk of breast cancer when used for more than 3 to 5 years. Therefore, in women with a uterus, it is recommended that physicians prescribe combination therapy only to treat menopausal symptoms, such as vasomotor symptoms, hot flashes, and vaginal atrophy, using the smallest effective dosage for the shortest possible duration, although estrogen is the most effective treatment for hot flashes. Non-hormonal alternatives such as low-dose paroxetine, venlafaxine, and gabapentin are effective alternatives. Systemic estrogen, alone or in combination with a progesterone, is the most effective therapy for menopausal hot flashes and is approved by the U.S. Food and Drug Administration for this indication. Because of the potential risks with long-term use of hormonal therapy, clinicians should prescribe the lowest effective dosage for the shortest duration necessary to improve symptoms. The exact causes of hot flashes are still unknown, but they are thought to be related to changes in the brain's thermoregulatory center, which controls heat production and loss, and is influenced by your hormones. During perimenopause, hormones start acting like roller coasters, with progesterone and estrogen levels changing in the wide variations. These ups and downs don't settle down until almost 10 years after menopause. There are several ways to deal with hot flashes. One of the simplest things you can do to try to avoid hot flashes is to keep your environment cooler, especially at night. You may want to keep a damp towel in the refrigerator or freezer, or use an ice pack. Wearing looser clothing made of breathable fabrics such as cotton can also be helpful. Many women use fans during the day as well. Smoking is terrible for your overall health and could make hot flashes worse. Avoiding alcohol, spicy foods, and caffeine are all pretty simple, self-explanatory steps. Eliminating stress is more difficult. Some early studies seem to indicate that mindfulness training can help reduce the number and frequency of hot flashes. That could be because mindfulness can reduce stress. You may want to investigate yoga, tai chi, meditation, or practice deep breathing exercises. Regular exercises can also help lower stress, and of course, limiting your voluntary commitments and scheduling time for relaxation can be important tools in combating stress. Relaxation breathing in and out for several minutes at a time may help reduce hot flashes. In addition, one recent study found that women who had acupuncture treatments 2 times a week for 5 weeks had a decline in hot flashes that lasted for 12 weeks following the treatment. There are new drugs and injections being tested that may take care of specific menopausal symptoms, especially if you cannot take hormone therapy because it may be harmful to you. A medical contraindication, or if you did not find relief with the other medications, these new drugs may be helpful. Talk to your provider to find out if you qualify to use them. First and foremost, you should start with lifestyle and behavioral changes, says Alyssa Dweck, MD, Adjunct Assistant Professor of Obstetrics and Gynecology at New York Medical College. There's also some reason to believe that eating more soy might be beneficial. One small recent study published in the journal Menopause found that women who ate a vegan diet that included half a cup of soybeans daily had a significant reduction in hot flashes. Some participants even found that this symptom disappeared. Keep in mind that natural doesn't always equal safer, says Min Kin. That said, there are a few herbal remedies that doctors say can be beneficial. These include Remifemin, which is manufactured and often used in Germany, where herbal supplements are closely regulated, and Relazin, which contains a pollen extract and is often recommended by oncologists in France. Minkin notes, another herbal supplement worth considering is Equelle. Minkin says this is a soy-based product, so it contains weak plant-based estrogen. It originally launched in Japan before coming to the US, Minkin says. The above-mentioned options are relatively safe and well-tolerated. As with prescription options for hot flashes, she advises waiting 3 months to determine whether a given therapy is working for you. Black cohosh is another herb that is used to treat hot flashes due to its estrogen-like activity. It is found in North America and is used for several other hormonal conditions like menstrual irregularities and premenstrual syndrome. Several studies have been conducted on the use of black cohosh in hot flashes. However, some of the studies have not been well conducted and the overall results are mixed. Wild yam also contains estrogen-like substances. It is sometimes applied as a cream locally to reduce hot flashes, but appears to be ineffective when used this way. Red clover is a legume, which contains estrogen-like substances. It is used for hot flashes and breast pain associated with menstrual cycles. Among other uses, DHEA is a dietary supplement that is converted to hormones in the body. However, there is not much evidence to prove that it is useful in hot flashes. Several other substances like flaxseed oil and valerian root have been tried out for hot flashes, but with doubtful efficacy. The selective serotonin reuptake inhibitor (SSRI) medications have been shown to be effective in reducing menopausal hot flashes. These drugs are generally used in the treatment of depression and anxiety as well as other conditions. Paroxetine is an SSRI approved to treat moderate to severe hot flashes associated with menopause. Clonidine is an antihypertension drug that can relieve hot flashes in some women. Clonidine is taken either by pill or skin patch and decreases blood pressure. Side effects of clonidine can include dry mouth, constipation, drowsiness, or difficulty sleeping. Gabapentin, Neurontin, a drug primarily used for the treatment of seizures, has also been effective in treating hot flashes. Megestrol acetate is a progestin that is sometimes prescribed over the short term to help relieve hot flashes, but this drug is not usually recommended at first-line treatment for hot flashes. Serious side effects can occur if the medication is abruptly discontinued. Megestrol may have the side effect of weight gain. Medroxyprogesterone acetate. Depo-Provera is another progestin drug and is administered by the injection to treat hot flashes. Research has shown that ginseng may help with some menopausal symptoms, such as mood symptoms and sleep disturbances, and with one's overall sense of well-being. Evening primrose oil is also promoted to relieve hot flashes. However, the only randomized placebo-controlled study in only 56 women found no benefit over placebo. Mock medication. Reported side effects include inflammation, problems with blood clotting and the immune system, nausea, and diarrhea. It has been shown to induce seizures in patients diagnosed with schizophrenia who are taking antipsychotic medication. One study showed that the vitamin E treatment option is effective. In general, it's always a good idea to talk to your healthcare provider before starting a new medication or supplement. Sometimes a product might seem safe on the surface, but it might not be a good option for you when you factor in other medications you take or other medical conditions you might have. Your provider will discuss each of these factors with you and make sure it's a safe product for you. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Do not forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video clip to watch for more health info. Thank you very much.